I don't know if you all are seeing this, but it is starting to get really creepy and scary. Um, so I came across this article and I found it to be extremely disturbing because this is one of the biggest banks for the U.S. and they're experiencing a shortage. So it says U.S. blood banks are experiencing the biggest shortage in a decade. And so I just want to say this before I read into this article. Something really bad is brewing and it's about to go down. I'm serious. And I know I don't normally say things that way in that fashion, but I feel it in my bones. And it's the sickest, scariest feeling that because of all of the festivities and the gathering, it is going to backfire in a really bad way for some people. And so it says the U.S. blood banks are experiencing the biggest shortage in a decade. And so this is unlike we've ever seen before. So the pandemic has caused many blood supply chains to bottleneck in everyday life, but a few are as critical as the U.S. or United States ever shrinking blood banks. And so this is pretty serious because right now a lot of people are sick. And what I've been seeing is that this Omicron is spreading like crazy and it's going to get worse. And I believe this is what I had been seeing previously. Um, it seems like it's something harmless, but I feel like it's a gateway for something even worse to come in and infect people. So right now, it's just basically going through as many people as it can, whether you're vaccinated or unvaccinated, and then boom, another one will come about, and it'll be one that'll be so bad that already they can't control this one right here. And they've been talking, there's been multiple articles, and people are just ignoring it because they've gotten so tired of this virus and all the efforts that they try to make have really just fallen flat. That's the truth. And what they've also said is 3 shots is not enough. And what I'm seeing is a disaster about to unfold eventually. And it's going to happen like it's happening now, state by state by state by state. And then you'll gradually see the impact of this. And so it says that which American Red Cross, that is the biggest one, which supplies about 40% of the nation's blood. Other nonprofit blood centers, the problem lies mostly at the top of the chain, the diminishing number of healthy blood donors. And so that's the issue. So this is the biggest challenge that I've ever seen in 30 years in business. So this is by a Chris Haruda, who is the president of biomedical services at the American Red Cross, said this in an interview. This was on Thursday. So donations of the blood typically decline at this time of the year. But when holiday parties, wintry weather, seasonal illnesses, travel, school, college breaks lead to lower donor turnout, um, that's basically, it says Harada said that this month's national supply had dipped to the level that they hadn't seen before. Red Cross has not seen this in 10 years. So it says, we simply like to keep 3 days of inventory, he said, but we're struggling to keep even 1 day. And so that's how bad it is. So blood takes up to about 3 days to be tested and prepared for a patient. So remote work, blood drive cancellations, the limits that colleges and businesses have placed on a number of people allowed in public spaces have all reduced the donor turnouts. And so we just didn't get as much access as we had hoped for in the fall. So Rhoda said, so I may not be pronouncing that name correct, so sorry for that. But compounding on this problem, the Red Cross, like many employers, is struggling to attract and retain employees as well amid this pandemic. So it's like a domino effect with the shortage of jobs and the shortages of businesses that are now, you're hearing about flights being canceled. I mean, by the thousands. Flights are being canceled and businesses are softly closing. So it is going down, and people are not really focused on it right now because the holidays have got y'all like spent around, and so it's just gonna hit like a whirlwind. So I just can feel it. It's just not good. But the critical shortage leaves hospitals to more carefully allocated the precious resource. Okay, so we have not had to delay any cases yet, but we are very mindful of that. Our blood supply is Dr. Jennifer Andrews, medical director of the Vanderbilt University Medical Center Blood Bank in Nashville, Tennessee. Blood donations are essential for surgeries, cancer treatment, chronic illness, and trauma injuries. So that's how serious this is. So just think of people who maybe they want to go to the doctor for serious, like major illnesses during some crazy pandemic like what we're having. And if they have this huge influx of people in the hospital, those people, if they need to get care right away in an emergency, they can't, and they have a shortage of blood supply. So this is a recipe for disaster in the medical world. So Vanderbilt, the only level 1 trauma center in its region, has recalibrated the transfusions that it uses to rescue patients. So by using fewer red blood cells to ensure that there is enough for all. So we still think that that's safe, but we know that saves lives, okay? So this is said by Andrew. And so other hospitals have altered the treatment as well for some patients or canceled some patients' surgeries. That's pretty serious. This is Red Cross official saying this. So Vanderbilt, an elective surgery put off today is an emergency surgery tomorrow. So this is how crucial it is, said by Andrews. So the medical staff has held 2 or 3 blood drives a month up to from one before the pandemic to help replenish the center's blood supply, she said. But more is needed. And so the nation's blood supply also faced a critical shortage after the March 2020, as the first wave of the coronavirus had started to spread across the country. So blood drives were canceled and the businesses were closed, and many people, especially older Americans, have had traditionally been the most frequent donors. And so this is what they feared was going into donation centers, and they feared going in there. And so at that time, the FDA eased some of the restrictions to help reverse the drastic drop in supplies. So we've overcome the fear of any sort of risk associated with the blood drive. And so this is said by Rhoda, who noted that the supply had largely bounced back until the Delta variant. So that's beginning to spread. So this article is about to come to a close, but there's other things that I wanted to talk about in this video that I thought was really important. So the Delta had begun spreading during that summer, so the blood bank directors are hoping that the supply will once again catch up to the demand. So every unit of blood is giving someone a life. So this is said by Andrews. So this holiday season, you can give the gift of life. So they're trying to call for people who have healthy, of course, healthy immune systems, or people that are have clean blood and healthy blood to donate if they can. But it's scary, and I guess the fear is what is set into a lot of people. That's the reason why you had a lot of people that weren't donating, and then they kind of expressed it. So this is out of the New York Times, and this was an article by Adil Hassan, December 26th. So blood donors are increasingly hard to come by the Omicron spreading. And so what I've been seeing is that this spread of Omicron is really bad. And so it says there's an update. The latest COVID wave pounds hospitals in some parts of the U.S. And so Department of Health and Human Services data showed a spike in hospitalizations in Washington, D.C., Florida, Hawaii, and Louisiana. But the wave is moving unevenly across the country. So nearly half of the states report lower COVID-19 admissions and fewer people in the ICU beds. But the extraordinarily contagious Omicron variant will continue to drive daily coronavirus infections higher across the nation. So this is said by Fauci. This was on Sunday. So more than 4,000 flights have been canceled or delayed across the nation Sunday as the airlines experience COVID-related staffing shortages as well. And so they have offered and expanded here in LA County free COVID testing because of what's going on. And what I'm hearing is that, I don't know, I think it has to do with money because businesses have been affected so bad. They're trying to find ways to save money, so they've shortened people's hours, or they've lost staff, or they have a shortage of staff, so they've closed stores. You have some that are just going online. CVS is supposed to close more than 900 stores. Rite Aid is supposed to close 63 stores. They won't tell what locations, but they're trying to save money. There are businesses that are slowly closing because of this variant. They have less business. They have less people coming in. Multiple flights, I mean, in the hundreds to thousands of flights have been canceled because of this. And so in some places, people are hospitalized to the point to where they're intubated. And so it's just like bouncing around. And from what I've heard is that through what I've pretty much researched is that the Omicron, once it gets into the person, they claim that it is the lesser of the evils, the lesser of the variants. It's not as one that will necessarily put you in the hospital, but it does have something to do with weakening that immunity. So it can get around or past the vaccines. So even if you're vaccinated, you still could get that. And then you could also, by having a lower immunity, you could end up getting the Delta, because I heard that one is now starting to spread, and it is getting people, y'all. And so all these people that are just going about life like nothing's happening, it is no joke. This stuff is getting crazy. So when you hear about the U.S. blood banks experiencing the biggest shortage ever in a decade, that's something not to just play around with. It's pretty serious. And I thought it was mad crazy because when I saw it, I was like, nah, no, this can't be happening, because you hear of some hospitals that are so filled up with people that have COVID. Some people won't even go to the doctor because they don't even want to catch it. They think if you're going to get anything, it'll be right there. And so these people might be some of the people that might have cancer, they might have other illnesses, and they need blood. With this happening, that just makes things more and more uncertain. So having said this, I think people need to wake up and see what's going on. But it has gotten crazy. This is additional. Outside of all of this, there's been a surge in crime in South LA. People walking into places and just taking things, taking what they want. And I would say this. It's not only just crime, random crimes, but there's also been crimes of desperation because of food shortages. And so even there were food banks that were complaining that they were having shortages. And so people are not really opening their eyes to see what's going on. Some have seen, yes, something is really wrong is happening. But in others, they're just going on, trying to pretend like it's not happening, and then all of a sudden, boom, it's going to hit you. And so I have a feeling that we're in for a huge, unwanted surprise, probably before the end of this year, beginning of next. And so by April, I don't even want to think about what's going to happen, but It just doesn't look good for some people. So I feel like some people are getting in situations that they're putting themselves in electively, not really knowing all the ramifications or consequences that are going to lie thereafter. And I believe these are it. And so it's spelling danger. That's what it's spelling. And it's a disaster in the making. And also, what I was seeing is that this Omicron, pretty much most people, it's spreading so quickly and so rapidly that most people they're saying probably will have it by April. That is very disturbing. So, if it can get around the vaccines and weaken your immunity and make that immunity a little bit less effective, what other variants other than Delta are coming out? That is the big question. And so they have not really tapped into that. I know they were talking about a pill. I don't hear too much about that. I don't think that's going to really work for this. I think there's something going to happen and it ain't going to be good at all.